Thank you very much, Your Excellency Raila Amolo Odinga, Your Excellency, our Deputy President, Mother Karua, distinguished guests, ladies and gentlemen, hamjambo. First, Your Excellency, your manifesto of 10 points is really a game changer in this country. When you talk about Baba Care, that is where it begins to build a wealthy and a healthy nation. Your Excellency, it is not difficult, quite honestly, to address issues health. What you have seen in the picture here is just to show that the first thing that we all got to address, and the manifesto addresses it, is to make sure that we prevent and promote better health care for all. That it should not be expensive for people not to afford. And I know with the commitment that you are making in Baba Care, this will be done. We know that a healthy nation, a productive nation, must first and foremost address its health needs. Your Excellency, these issues of health has bogged Kenyans down and have been unable to access better health care. And there can never be a better chance for all Kenyans today to get better health care through your government as Miola Umoja that is coming in. You have committed yourself, you have shown it, you understand it, and we know what needs to be done. That team you are going to put in place needs to understand from the records that we have, 5.7 million Kenyans after the COVID are unable to access health care at all. And therefore, looking at it and the resources available, we need to go to all the health facilities in this country, make sure that we have available drugs, make sure that we have available health workers, motivated, well-resourced, and going there to go. We need to make sure that people understand the importance of health. We need to make sure that women can access better health care. We need to deal with maternal health and infant mortality, health that has bogged down many African countries. The difficult areas to reach can actually be accessed through mobile clinics, and that again is doable. So I do believe with a commitment, ile tumeona baba akiongea, kina mama, watoto, wote waangaliwe vizuri, watibiwe vizuri, because it's a very expensive affair, needs to start at the primary health care level. We need to ensure, and Baba, you have talked about it, that they can be diagnosed in good time. They need to go to health facilities which are near their places. And the Baba Care also is going to take into account what you have told us, that resources for health need to be devolved. The functions have been devolved, but the funds have not been devolved. So once this is done, I'm sure we are going to have proper health care for this country. It is doable in inawezekana, and we are looking forward to having that. Final one, Your Excellency, let us ensure we can restructure and ensure there is capacity in NHIF and in KEMSA that distributes drugs. Because once again, it is possible for drugs to be distributed in the entire country seamlessly and easily. Hii ni kusema kila mmoja wetu anaweza kupata matibabu ambao anaweza kuafford. Si wale wanaweza. Na ya mwisho, hata sisi wakubwa tuende mahospitali yetu ya public ili sisi tujue what our people go through. Kwa sababu ukiwa uwezi ukaenda our public hospitals, then what kind of a leader are you? During the COVID, hakuna mtu alienda nje, sisi tulikuwa hapa. Kwa hivyo sisi tuendelee na hiyo. Asante sana, Your Excellency. Your manifesto is really holistic. talking about food, making sure that people have good food, making sure that people have clean water, and this is where better health begins. Asante sana, Mungu atubariki, tukienda kuingia kwa azimio serikali ili tuende na tuiserve. Asante sana.